Hi, everyone. Good morning. This is Timmy Leslie with Blue Path Health, and we are incredibly excited to kick off our day for a day filled of how eConsult is being used to solve access problems or issues in the U.S. We are joined here today with our fireside chat, which is our interactive piece of our program. As we're going virtual, we all, I think, miss our time together to network and to be able to have questions. So we're starting our day with just that. And we have invited CONFER Med and Dr. Darren Anderson, who's the founder and president of CONFER Med. And he's joined by several of his colleagues to walk us through how they are thinking about eConsult and the ways that they're applying the pipeline to address access to specialty care and other care. With that, I would like to hand it over to Dr. Anderson, who will moderate our session. It is being recorded. And if you all could use, I would encourage you to use the chat session as much, or the chat to put in your questions as much as possible. Dr. Anderson, I'd encourage you to ask questions to this group. It is a group that I think we can manage and hopefully be able to progress with the discussion. Dr. Anderson, please start.
Great. Timmy, thank you so much. And welcome, everybody. Good morning. I know on the West Coast it's early, although here on the East Coast, I'm actually talking to you from Connecticut. It's 11 o'clock, so I've been awake for a little while, but it's great. You know, we weren't exactly sure what to expect with this session. And so I think what I would like to try to do, what I don't want to do is talk more about eConsults and how they improve access. And actually, what I also don't want to do is talk all about eConsults and how they save money and help you with shared savings and those sorts of things. I think especially in the state of California, those are topics that we've all become well familiar with. And we've spent, the last probably 10 years or more thinking really, really hard and carefully about how to connect primary care providers with specialists. And that's been an amazing journey. And we've accomplished so much, all of us in the eConsult world in California. And there's lots to celebrate in that regard. But what I was hoping to do today was to really kind of ask the question, okay, now what? We spent years developing a digital connection that links primary care providers wherever they are, whether they're in the most rural, small family practice in the middle of the Central Valley, or whether they're in downtown LA. We've spent all of this time connecting them and building a digital pipeline that allows us to connect them to anyone. And most of what we've focused on so far is connecting them to dermatologists, connecting them to orthopedics, connecting them to rheumatology. In the Central Valley, neurology is my own personal headache. And as we have built that connectivity, I think we have, very appropriately focused our efforts on how can we build a specialty network and connect those people so that we can share clinical information and get consults going. And that's important. But what I'm hoping to do today is to say, all right, what else can we do with this incredibly important and valuable connection that we've now established? Because as a primary care provider myself, who worked for many years in an FQHC, I can tell you there's an enormous need for connection. We used to round in the hospital. We used to go in and see our specialty colleagues. We used to have the opportunity to run an EKG by a colleague, things like that. Those opportunities are few and far between now. And so what can we do with this digital pipeline that we've created above and beyond simply connecting specialists and primary care providers? So that's what I'm hoping to talk about today. And I'd like to start by introducing my team. And I think we're going to be kind of winging it because I know people are going to be dropping in and out. I'm hoping that we can actually have a conversation about this. I have a few slides just to get us thinking, and we would like to show a demo of something that I personally think is unbelievably cool and represents a new way of thinking about what we can do with eConsults. So, or if I were a millennial, I would say it's super cool. I still struggle with that one. But anyway, let me introduce my team first. So we have several people from the CONFER Med team. I'm going to start with Agi, if you wouldn't mind introducing yourselves, and then Asha.
Thank you, Darren. Hi, good morning, everyone. I'm Agi Erickson. I'm Director of Business and Partnership Development. Really excited to be here with all of you. I've been working in primary care setting for over 16 years and been really supporting primary care practices across the country and a lot of practices in California to improve the scope of primary care providers and to build innovations.
and Asha.
Everyone, my name is Asha. So I am the CONFER Healthcare Account Manager. My background is primarily in actually health insurance and dental. So I'm also excited to be here. We have some amazing things to kind of present to you this morning, and I actually sit in California.
Super. So I see some people coming on camera, not to put you all on the spot, but if you're willing and able and have the potential, it'd be great to be able to see each other as well, since this is intended to be an open conversation amongst all of us. And Sajid, that means you especially, because I know that picture looks a little bit too canned for me. Oh God, he's driving. Hi, Sajid. Good morning. All right, so just to frame up sort of who we are, for those of you who don't know us, I'm going to give just a brief introduction about ConferMed, a little bit of background, and then we'll jump right into our topic of what do we do now with this amazing digital pipeline that we've created to primary care. So the topic of the discussion is expanding the vision and the scope of eConsults. How can we support advanced primary care? So just a quick word about who we are. So ConferMed, we are a national eConsult provider. We are a nonprofit, and we actually have the unique distinction of being a subsidiary of a community health center, of an FQHC. And everything that we've done and developed was originally tested and refined and revised in Connecticut at a company called the Community Health Center, Inc., which is a statewide health center in Connecticut that's been around since 1972. And we originally started this whole idea of eConsults to tackle probably the same problem everybody else comes to eConsults with, and that was the problem of getting access to specialty care. Well, since that time, and since all of the work that's been done, we've now created an infrastructure to be able to take what we learned in Connecticut and provide it to FQHCs and other safety net practices around the country. And you can see from our slide, we're now in 17 different states. We've done over 50,000 consults, and we have a team of specialists, over 200 now, in 40 or so different adult and pediatric specialties and subspecialties that are now connecting and providing eConsults to frontline pediatric and adult family providers in South Dakota, Maine, California, Oregon, and you can see states all over the country. And that is an accomplishment. Figuring out how to do this in your own health center is a challenge. Figuring out how to do it state by state presents a whole nother series of challenges. And we spent a lot of time really learning the intricacies of different state licensing and regulation, how to get paid in different states, different payment environments, and that's key. But in my mind, this is, I don't want to say this is the past, but this is what we've been talking about now for almost 10 years. And the fact that 70 to 75% of the eConsults support or even prevent a face-to-face visit in many cases. And in California, which is far and away our busiest state, you've been at it even longer than many of our colleagues in other states. We've done almost 7,000 consults now, and you can see from the map, we are largely been focusing on the Northern and Central Valley territory, and recently and increasingly down in the South in LA and Orange County and Imperial County as well. And we have about 134 sites that are using ConferMed, almost 700 PCPs that regularly and routinely use it, and they like it. We put our satisfaction score there on a 5-point Likert scale. Our average scores are 4.3. So I think it's fair to say that we and many others like us have really figured out how to connect specialists and primary care providers. There's much more to talk about: how to get paid for it, how to compensate or address the issue of increased support for primary care providers, the need for the extra time that it takes, all of those topics. But I think while we're doing that and continue to have those discussions, I think it's really important for us to take a step back and say, okay, we've created this digital connection. How do we use it? So what I'd like to do in the remaining time, and I'm going to introduce, I have some very special guests that are joining us from a group called Diet ID to show a little bit, and I think maybe get the juices flowing in terms of what I think is now worth thinking about and possible with eConsults. So let me frame up a couple of the things that I want to share with you today. So we've talked about value and convenience for patients, reducing specialty access, working down referral backlogs, and reducing cost. And what we're going to talk about today is a couple of other possibilities. Once you have connected primary care providers digitally and you figured out how to link up with their EHR, who else can we connect them with? Can we connect them to other primary care providers? Can we connect with patients? Can we share information from patients and incorporate that into the eConsult? And also want to touch a little bit on Project Echo and how eConsults can be used to augment what we do with Project Echo. So let me start with that. One of the things that we started a couple of years ago and are now expanding pretty significantly is the use of Project Echo. Most people are familiar with the traditional Project Echo, where you join faculty members to teach primary care providers how to manage Hep C or how to manage opioid treatment, medication-assisted therapy, things like that. But one of the things that we came to realize is that the eConsult data that we're transmitting and receiving gives us a window directly into primary care, and it helps us to view and to see exactly what primary care providers are asking questions about. It gives us a much more, I think, up to the moment accurate assessment of what are the most common challenges. Primary care providers send consults when they have a question, when there's something that they're struggling or challenged with. And so we've built a whole Project Echo, we call it CONFER Echo, where instead of having a fixed curriculum, we actually look at the consult questions coming in by different specialty, and we use that to drive the agenda. So the agenda of a typical ConferMed Echo is based on the actual most common questions. Just as an example, we know that with endocrinology, you would expect that our most common endocrine consult might be related to type 2 diabetes, and it's one of the most common. But actually the most common are questions related to the assessment and management of thyroid nodules. So our first Echo session focused on the assessment and management of thyroid nodules, and we used real cases from the eConsults that we get, connected with a faculty that included some master clinicians in family medicine, along with an endocrinologist and a pharmacist, and we delivered a session about that. And so I think the point here with Project Echo is to think about how can we use eConsults not just as a transactional tool to send consults back and forth, but how can we use it to learn more about what primary care providers need to know and want to know, and use it proactively to educate. And I think the beauty of Project Echo is it's not a fixed CME webinar where you sit and listen to it, but rather it's an interactive discussion where frontline providers can talk, ask questions, engage with each other across the digital spectrum with specialists and others. And so that's an Echo that actually now runs twice a month, and so it is available to all of the users of our eConsult platform. The next thing that I want to frame up before we get to the demo that we want to share with you is thinking about who we are connecting our primary care providers with. We certainly connect them with all the different specialties that I've talked about, but think about what you can do if you can connect your frontline primary care providers with other primary care providers. FQHCs around the country are required to do something called peer review, where clinicians review each other's charts and give them an assessment of how well they're doing on diabetes management or hypertension or things like that. We've actually created the mechanism to do that exact same thing, but using the ConferMed eConsult connection. We have an entire team of, I call them my master clinicians. They're family docs, pediatricians, internists, who can, same way we send an eConsult, take clinical notes and clinical information from the frontline provider's chart and do peer review, actually review their chart, review all of the information about their diabetes management or whatever. We have actually 5 different topics that we offer. You can see them listed here. Actually, there's more, including behavioral health and dental now as well. And our master clinicians can then send a peer review form back that outlines what they found on the cases that we reviewed, and then give a summary presentation to the entire clinical staff at the end. And this is a slight pivot from what we think about when we talk about eConsults. But if you think about it, it's the same idea. We've connected the electronic health record and using an eConsult platform with a group of specialists, in this case, they're primary care specialists, and we're able to provide service, support, knowledge, expertise back. And I think that peer review is becoming an increasingly challenging issue for frontline providers and practices to figure out how to do it. It takes a lot of time. There's a lot of cost associated with it. And this is another way that we can use the power of that digital connection to provide a different type of service back to practices that may not have the resources or the time to take time to dedicate to doing peer review on their own. So But the real thing that I want to talk about, and I think I wanted to throw out a couple of different examples of ways that we're thinking about using this connection. But I think that potentially the most interesting area that we're excited about at ConferMed is the idea of collecting information directly from patients. And eConsult is only as good as the content that you get from the primary care provider's chart. And as a primary care provider, I can tell you I'm not always the best at documenting all of the details, and I'm especially not the best at documenting anything about what patients put in their mouths or what they eat. And so we were thinking last year about the important need to provide diet, nutrition support for providers and for patients. Dietitian services are not available and in many FQHCs, and they're certainly not available at scale. And yet the vast majority of illnesses that our patients are suffering from relate in some way, and in many cases are directly caused by what we do and don't eat. And so we started thinking about how can we provide dietitian e-consults to our primary care providers across the country. And we realized that there was one big gap. And that gap was what I kind of alluded to, that primary care providers generally don't do a great job capturing. It's challenging to capture what your patients actually eat. So we started thinking about, would it be possible for us to connect directly to the patient and have them complete an assessment about what they ate and incorporate that into the consult guidance that was coming from ConferMed and from the primary care practice. And if we could combine those two, the patient information and the practice information, the dietitian might have enough information to be able to actually complete and provide useful guidance and support and tools, handouts, diet, meal plans, all sorts of information that the primary care provider could then implement in their practice. And so that's really, if you think about that, even though it doesn't sound that complicated, that's a paradigm shift. Going directly to the patient to capture the information and then incorporating it into your consult. And that's really what I want to spend the remainder of our time showing you, and then we'll pause and hopefully have a good half an hour to talk and engage in a discussion. So we partnered with a really interesting, innovative company called Diet ID. And we have two members of the Diet ID team here, and they are going to walk us through exactly how we did this and how it worked, and then we'll show you a real example of a dietitian consult. And so, Rachna, can I ask you to introduce yourself and then Dina as well? And I want to say welcome and thank you for joining us on this morning fireside chat.
Yeah, hi everybody. I'm Rachna Govani. I'm CEO here at ID. To be here, say hi.
My name is Dina Aronson, and I'm Director of Nutrition Programming at Diet ID. I eConsults with ConferMed.
Great. So what we're going to show you, and Asha, I understand that you have the video ready to go up. We're going to show you what it actually looks like to use Diet ID, and I just want to describe sort of how we deployed this. So we've now piloted this in 2 different clinics in California. Both of them were using ConferMed for orthopedics and nutrition and neurology and everything else. But when they requested a nutrition consult, a dietitian consult, the patient was asked if they were willing to receive a text. They consented. That consent was transmitted to us in the consult. And we sent the patient a text link directly to Diet ID that allowed them to now enter Diet ID's system and provide the information. And you'll see why I think that was really important. This was not just a diet survey or a recall kind of a survey. It's something much more interesting and engaging. And so without further ado, I'm going to let Rachna and Dina walk us through what that actually looked like and how it worked.
Diet ID's simple and quick digital diet assessment empowers providers to meaningfully help their patients improve their nutrition, the most important predictor of chronic disease risk. If a provider requests a nutrition e-consult, all the patient needs to do is take this short and robust and validated nutrition quiz. The quiz is accessible on any web-enabled device. The experience is image-based and low on text, making it easy for any population of any background to engage. The patient will choose images that are closest to what and how they eat. The patient then enters some very basic inputs, and in as little as 1 minute, we have captured and analyzed their current nutritional intake. They can then tell us about their health goals and then set a goal diet. The Diet ID system then generates a full nutritional analysis and nutrition plan in real time. This information is used by our dietitians to provide a detailed, actionable nutrition eConsult and plan, complete with a meal plan that's printable, as well as resources you can use to understand the issue as well as share with your patients.
Great, Rachna and Dina, thanks so much. So, and I actually have a real example of one of Dina's consults that I'm going to put up. But Dina, do you want to talk a little bit about, as one of our nutrition dietitian e-consultants, sort of what you see on your end and what you've been able to do with it so far?
Sure, thank you. So as a dietitian, my role is to interpret the patient's dietary status, assess their nutrition needs, and come up with a nutrition care plan. So when a new patient completes the Diet ID quiz that Rachna just showed you, I get an email notification. So I can immediately log into the eConsult portal to collect information about that patient, like their health history. I get their labs and clinic visit notes. I also have access to that detailed report, that diet assessment that Rachna showed you. So I get their diet type, the diet quality, the composition, and their health goals, and the diet that they're interested in working toward. So with all that data, I'm able to provide the clinician with a comprehensive diet and nutrition note, including specific recommendations that are personalized for the patient, like educational handouts, meal plans, and specific nutrient guidelines. And that allows everybody involved to come together as a team for every patient's nutrition care. And that facilitates communication, improves outcomes, and increases success.
Dina, when you send the consult back, we send it back through the same way all the rest of our consults go, usually as a PDF, but I think we're also providing, and you've been able to highlight specific handouts and specific meal plans that the provider can download, print out, and provide for the provider, for the patient as well, right?
Yeah, that's correct. So there's a part of the portal where we can store all of those handouts, and we just click on the ones that are applicable to that patient. So it's super easy and fast.
Now, when it works really, really well. The patient completes the assessment. Dina and the team have access to that information. But Asha, you were in charge of actually making this work, and I know you made it work. You made it work in several different settings, including some very rural parts of Texas, but also several locations in California. Do you want to talk a little bit about how some of the clinics, how they got this done? Because what sounds easy often, when it gets down to brass tacks, is not always so easy.
Yeah, absolutely. So a lot of it, I mean, and I know we will hear from Dr. Hakim later on. Thank you so much for joining. But a lot of it was the work too of just on our side, Diet ID side, as well as the organization that is actually implementing the assessment. And so what we did on our end for an internal workflow is we made sure that each patient actually received the text from us to complete the assessment. And we have our referral staff who reached out a couple of times just to make sure and ensure that they were able to complete it. And we worked simultaneously with the medical staff at the organizations. And so after we kind of completed that, we followed up with the providers, made sure that their needs were met. We had some experienced providers. And again, Dr. Hakim is one of those who was able to really give us some good feedback and make sure that it worked and to provide the service for their patients.
Great. Would you like to introduce Dr. Hakim, and let's get some feedback directly from the front lines where we actually did this?
Absolutely. So we have Dr. Hakim on the phone, and he is the medical director at SNAC, which is in Sacramento. And I'm not sure. I see you're muted, Dr. Hakim, if you're talking.
Oh, I'm here. Okay. I'm just driving, so I apologize if you hear background noise.
No problem. But yeah, if you could please give us just quickly, how did it work out for you? How did it work for your patients, for your organization, and what feedback did you hear from your providers as well?
I think it's been very helpful. As you've already alluded to, it can be very challenging to get a really good nutrition history from our patients. So this gives them an opportunity to look at pictures that most resemble what they would eat, and then they go through it. The part that we've had to adjust is making sure that the patients know that they're getting the text, but because for whatever reason, patients sometimes think that it's a telemarketer or something else. So we sometimes give them the website before they leave the clinic so that they know what they're going to be filling out. They may choose to fill it out at that time, and once the referral is gone through, then we'll get the information back. we've been able to give the patients the information directly, which has been helpful. And then we've brought them back in for a follow-up appointment just to discuss what they've seen and see if there are any questions or concerns. So far, so good. We've been excited about it, and we're looking forward to the next iteration.
You're muted, Darren.
You're on mute.
Terrible. All right. Sorry about that. Thanks, everyone. Right. So I think what I'd like to kind of open up for discussion and is now that we've been able to collect information directly from patients, combine that with eConsults, what other opportunities does this potentially present? Social determinants of health, musculoskeletal assessments. I have a whole laundry list of things, but I'm really curious and anxious to get any thoughts, feedback, or field any questions from any of those of you who've joined us this morning.
Darren, I'm here. If anybody would like to ask a question, feel free to unmute yourself or raise your hand and I can do so. Or put a question in the chat. Darren, I'll get us kicked off. So is this a pilot or do you have plans to be, how would it be introduced as a service as part of the eConsult, or what are you thinking about that?
Yeah, so it was a pilot, and it's now standard available as one of the specialties that we offer to all of our members. And I think one of the first keys was the Medicaid managed care plan's willingness to reimburse for it, and I'm happy to say both Anthem and HealthNet were willing to do so. So that obviously, gave us, the financial ability to continue to deliver this. I think one of the biggest challenges that we found was, not every patient has a device that we can text to, although most do, and not every patient completed when we sent the text. So texting patients a link to a survey may not be the best or may not be the only way to do this. And so Asha's next pilot is to actually deploy a tablet at the clinic and where they can put the tablet in the patient's hands. And once you have a patient with a tablet that's connected to ConfirmMed, my mind just starts racing about all the other things I would love to ask them about, all the other things that they could potentially provide depending on who the consultant is. And so I will say our next pilot, which is a pilot that we're getting ready to launch, is enhancing our orthopedic consults by asking the patients more specific questions regarding their musculoskeletal complaint. Primary care providers don't tend to take a really detailed, in-depth orthopedic assessment necessarily. And we're working with a company called Upswing, which is actually based in the Bay Area, that's developed an interactive, intelligent designed survey that asks, as patients answer questions, it modifies based on what they're saying to really drill down on exactly what's going on with their knee or with their hip or with their back. And then that information combined with the orthopedic eConsult gives our orthopedic team of consultants the ability to have much more information to give a much more informed consult note back about what's most appropriate. And if you think about where that could go, virtual physical therapy, connecting via telehealth, I think it opens up the possibility of something that I call a musculoskeletal care pathway through ConfirmMed, powered by ConfirmMed and powered by that digital connection that we've established.
It's really exciting. We've been working with eConsult for so long and to think about where and how it can be used. I would love to hear a little bit more about the work that you're doing connecting provider to provider, so primary care provider to other primary care providers. I know we've heard about that in more like diabetes management, when a primary care provider may be, the specialist among their peers, but more about where you are seeing peer-to-peer on the PCP side would be great.
Yeah, it opens up a lot of other interesting possibilities. Now, so we have we've used it in a couple of different ways. The peer review is a very specific service. Most FQHCs, pretty much all FQHCs, are required to have some form of peer review as part of their Joint Commission, and so we can offload that task. And we have a team of primary care providers that that they're peers. They're not peers from your same site, but they're peers in the same area. But I think what we're seeing even more use from is what we call complex primary care and complex pediatrics, where If you're a relatively newly trained clinician, maybe you're a new grad, maybe you're a nurse practitioner who just completed nurse practitioner trainings. A lot of times the case isn't necessarily just about cardiology. Sometimes you really want to be able to confer and to talk with an advanced master clinician and get advice about a case. And so we call them complex adult and complex pediatric eConsult. And in those cases, we connect them generally with one of our Weizmann Institute clinical preceptors who precept in our residency programs. These are academic trained clinicians that are used to handling complex cases, and that tends to be a really, really valuable consult. So again, it kind of takes us beyond just thinking about neurology and primary care, and I think that's another way to just take the tool that we've already developed and utilize it in a slightly different way.
I think that, the idea of using eConsult overall with this kind of closed loop where the primary care provider is able to know that that consult occurred and is then able to do some type of action. And we've been working in Marin County on thinking about how to connect teens and young adults to behavioral health providers and have, whoever is the lead at the school likely to be able to make sure that actual consult actually happens. So I'm actually kind of going way out of the box here and thinking about where you might be able to use eConsult to be able to help, care providers or care coordinators that may be in the community to then be able to connect to maybe just do a screen, not just, but to do a universal screening in a county, which is what we would love to see, and then be able to make sure that those that need to be seen are seen. Have you thought about how that might be able to be used?
Yeah, and I really like that idea a lot. I think, and even thinking a little more broadly with social determinants of health, the basic premise of it may be a clinician who identifies the need and triggers the initial consult. But in many cases, behavioral health, like you used, assessing specific social determinants of health, providing support to the patient for social determinants of health. These are many things. These are things that often the primary care practice doesn't have the ability to deliver. But if you think about this digital pipeline that I keep calling it, and being able to connect people in different ways, and even close the loop with a direct face-to-face consult, I think is opens up a lot more possibilities. But I think it's got to be. Our motto is confer before you refer. And I think thinking broadly, by doing that, by connecting electronically and having a consult or a patient-specific need reviewed first, it allows you to determine sort of what's the appropriate connection. Can it go right back to the primary care provider with advice? Does this need to be connected directly by video to speak to the urologist or the behavioral health provider? Primary care providers provide more behavioral health services than any other specialty. 50% of all behavioral health is delivered by a frontline primary care provider. And so that's not always the wrong option to send back a consult to them. But as we know, in many cases, when they're more complex, we don't have access to those additional providers. And so being able to route it different ways using digital tools, I think, is really exciting.
And I know that we were really kind of thinking out of the box in terms of how to use the eConsult, but you just opened it up. Have you also been thinking about eConsult to telehealth, to a visit with being able to connect the patient to the specialist and to have that as a virtual visit? And I know some plans have thought about that as a pathway.
Yep. No, we definitely have. I think, I really don't want to get into the business of doing direct-to-patient live telehealth myself, and as a company, we don't. But I think as a portal to that, I think if you just open up if you don't confer before you refer, and you just open up a telehealth connection between specialty group and the frontline primary care provider, all of your consults will go through that route. And it misses the fact that a telehealth visit is a scarce resource. It's an expensive resource as well, and it may not be necessary. I think that the principle of using an eConsult first is to determine when can the PCP handle it with an asynchronous communication versus when does the patient and the specialist need to get involved and talk together. So I think, connecting so that the eConsult is reviewed, the information is then potentially forwarded to a video telehealth provider when appropriate makes the most sense.
I'm just sorry.
Sajid, you're surprisingly, and I am picking on you because I know you, and I know you have lots to say about topics like this. And I know you're driving, so I don't want to put you at risk on those LA freeways. But I'd love to know your thoughts about what we're talking about. Oh, good.
Yeah, and actually, this is this just conversation between the two of you, Timmy and you, that's where I honestly think e-consults are going, as you put it, Darren, so rightly. You know, we've connected the providers together, but you know, for unfortunate reasons because of COVID, I think the reality of trying to not just close the loop with the e-consult with the primary care provider when a patient does see a specialist now virtually, I think bringing in the patient into that e-consult conversation after or during that entire e-consult process is probably, in my view, the next evolution of e-consult. Now that patients are making appointments virtually, and I'll give you an example. We were just having a conversation this past week with a clinic that we're launching eConsult with, and part of the Q&A that you guys do, that SNC, Rubicon, and Arista, I'm sure they all do, is ask this question. You know, how is your referral process? What do you guys do? What's that intake process? And of course, every clinic, I think now, at least the one that I participated in this past week, said, oh, we do it all virtually. So we have the patient virtually. The patient then sees the primary care doctor virtually. So I think there is an opportunity to not only have an e-consult between patient, specialist, and PCP, but of course, the immediate transition is from an asynchronous e-consult to a live video e-consult, or even a phone e-consult. So I think there are opportunities if that workflow in the future sticks post this COVID period, which I think we're all thinking is going to be the new normal. Yeah, this is a great place to go.
It's another thing that we've been thinking about. I'm glad you raised it, and I'd be curious what some of the other participants think. But we often get a request from the primary care provider saying, you know, or from the specialist, they'll say, this is kind of complicated. Here's my best response. But if we could just talk about this briefly, I think we could work through and come up with the best care plan. If we could just specialist and primary care provider, with or without the patient. So we do get requests a lot to, you know, as they say, can I just give them a call? And, you know, the standard response is an e-consult services, no, you can't, for all the reasons you can think of. It's difficult to schedule. We don't have the time, blah, blah, blah. But I do think in certain scenarios, after the initial e-consult has been reviewed and responded, being able to set up a case discussion for a complicated case makes a lot of sense. One challenge with that is that obviously takes time, a lot more time than just doing e-consult. And so far, as we've floated this idea to some of our more progressive payers, nobody's been willing to kick in the funds that you would need to be able to support that. And I think that's actually one of the uses, I would say, of those e-consult codes. We use the 99452 code for just 99451, but what's the other one? The ones where it opens the opportunity for a telephone discussion as well as an e-consult.
I think it's the 241 codes or whatever, but yeah, there's another set of codes.
Yeah, where it's time-based and where it depends on how much time you spent. And I think that's a potential opportunity if used judiciously where you could combine those. And I guess I want to ask Dina and Rachna, because they've been so generous to join us. And I know the way we heard about Diet ID, they're actually also Connecticut. Well, you're not Connecticut based, although your founder is here in Connecticut, right up the street from me. But I know this wasn't the way you originally thought of ID. We kind of modified things, and we both got together and brainstormed and thought a little bit differently about it. But I guess I'm curious, have you ever thought about, once we have this diet information, the combination of what we have from the chart and what you have from what we get from the patient, of then using that to deliver services directly to the patient? Asynchronously communicating directly with them, sending them weekly meal plans, or even giving them video dietitian services. Is that something that you have thought about? Because we haven't really gone there yet.
Yeah, so we do have a digital daily coaching module that's not, it's not human coach. It's automated, it's personalized, and it really provides the day-to-day guidance somebody needs to make the changes over time that we're recommending. And that's typically how we service that need, but absolutely we see value in the information we provide with additional follow-up in some capacity, whether it's a case manager, it's empowering the PCP to really have those discussions without disrupting their workflow, or somebody else. There's absolute value. We've been deployed in, we have this deployment with you, and then we have other deployments where we do have live health coaches actually using our plans to provide that type of ongoing guidance. And then they also have the ability to have the back and forth to kind of unearth some of the things that might not be immediately visible from some of these complex cases that you guys are talking about.
I mean, this is where I would really like to go. If you watch Forks Over Knives or any of the documentaries about the impact of diet on health, I have a hard time coming to work thinking about treating diabetes and cardiovascular disease the way we do. And even with a great eConsult where you recommend Lipitor and other medications, when you realize so much of what we're treating could be much better managed, or could be managed as well through more support for diet, exercise, wellness. And so I think thinking more broadly about is it possible to use this type of a tool to provide wellness support? Can we intervene on exercise? Can we use it to guide primary care practices and providers, and even directly connecting their patients to wellness plans and things like that? Because I think we spend so much time treating illness rather than preventing it. And this, to me, was the first sort of glimmer of a way that we might be able to do that.
Agreed. I think it seems like you're really opening up a horizon of, it's just really about, now it gets back to where we started with eConsult. It's about payment and participation and workflow. And how do we, work with the PCPs to be able to take that on? And that's where I go immediately.
Yeah, I mean, I called this presentation "Advanced Primary Care Powered by ConferMed" because I think what we're trying, in advanced primary care is a term that we hear more and more. But in addition to its meaning, in terms of augmented capacity to engage in team-based care and all that kind of stuff, to me, advanced primary care means that we are empowered to think about the entire patient, the whole patient, and we're thinking about wellness. We're thinking about disease prevention and management, in addition to the standard sort of treating with antibiotics and the things that we need to do. And I think, powering advanced primary care means we need a tool to connect primary care providers with all of the added resources. Most primary care providers are not expert at addressing social determinants of health, and they may not be expert at wellness, exercise, nutrition therapy, things like that. But this gives us a way potentially to connect all of those pieces and to power that advanced primary care using new ways of communicating. And I think this is really just a glimmer of what might be possible. I see several others. Go ahead, Timmy.
No, go ahead, please.
No, I just wanted to see if any of the others that are participating, if any of this has generated any questions or thoughts. I think I'm really interested in just starting to think differently about what we might be able to do with this type of communication technology.
I just have a quick question, which is that there was a recent study about gastroenterology eConsults where there actually was a direct, at the end of an eConsult, a direct communication between the gastroenterologist and the patient. So that's another element that possibly could be integrated into the workflow. Is it possible at a certain point but then it has to go into the medical record because the PCP won't know.
I know I'm actually not familiar with the study that you're referring to. I'd really like to see sort of what they did, but we've talked about that a lot about, go ahead, Sajid, you were going to say something.
I'm with you. I'd like to see that study too. That's exactly kind of the thinking that I mentioned earlier, is that post an eConsult, because of the pandemic environment and people having to seek and follow up with their primary care provider remotely, we're seeing in the Inland Empire a number of requests for the patient follow-up with the same specialist that talked to the primary care provider. I think, Emily, that's what you were talking about, right? That the specialist who did the consult, are you guys seeing, there's a study that's showing that GI or whatever specialist is following up with that patient remotely after eConsult? Is that what you're talking about, Emily?
Well, it was more just to deliver, for example, okay, you need a lab test or whatever. And it was it's in Texas, it was a gastroenterology clinic that was overwhelmed with a gigantic waiting list. And that's one of the ways that they started to do that. So it depended on the result of the consult, obviously.
Of course.
But there were phone calls between them. Yeah.
Yeah, Dean, I've asked you in the past about, well, gee, would it be easier if you just communicated asynchronously but directly with the patient, with the diet plan and all of that? And we haven't really crossed that threshold yet, but certainly conceptually possible, I would imagine.
Yeah, I think so. Especially with follow-up and to make sure they understand the instruction and to see if they have any questions, because it is pretty straightforward, but we want to make sure that they receive and understand the advice that we're giving them. For sure.
Darren, if I may, and Dina, I just want to say your application of nutrition in the eConsult process is brilliant. And I'm thinking this concept of getting the patient engaged in that eConsult process for nutrition in this use case with the primary care provider and that nutrition specialist, I think is beneficial, right? The more people that are engaged in a care conversation with the patient, especially around nutrition, I would guess that would be more valuable, right? Like peer pressure, kind of like a care team approach. So engaging that patient as part of that eConsult process with that primary care, would you guys see that as a benefit to this process in nutrition follow-up?
Absolutely. A team-based approach is going to be, I think, generate more successful outcomes, just because, diet is one of those things everyone eats every day and things change day to day. So if that can become part of the conversation among everyone, I do think that's an important element.
That's awesome. Great idea.
I'm looking for, go ahead,
Darren and Sajid, one thing that just occurred to me is the work that UC Davis is doing with behavioral health and asynchronous video visits with the patient, with the specialist.
Yes.
I'm wondering if that could potentially be deployed here.
I love that idea. And if you think
video.
about
Yeah,
asynchronous video. I mean,
so that you could,
I was going to ask, that's even more, I think, innovative than what I was going to suggest, but thinking about patients capturing information directly. What about all the dermatology consults that we struggle with? And could the patients capture the picture of the rash themselves? And then, if you think about it, if you open the portal to connecting with the patient directly, what else can the patients tell us that could help us provide better care? Maybe derm isn't the greatest example, but sure, behavioral health, asynchronous, capturing the patient talking about what they're feeling, what's going on, even capturing a video. If you're doing a neurology consult about somebody with an altered gait, capturing a video of that, I think once we open up, every patient has it. Most patients have some kind of a device that can capture pictures, that can capture information, and can capture video. That's a powerful tool that we're not even, I don't think, just barely beginning to think about using.
Well, I think the real power is when you are including the PCP in that discussion, so that they're able to help, in that coordination.
Yeah, right. I think if we go direct to patient and just cut the PCP out, then we're missing an opportunity to strengthen and build advanced primary care where the PCP is not necessarily at the center doing everything, but certainly supporting all of it.
Agreed. Well, with that, I'm actually looking at our time, and maybe if okay, Darren, if we could transition to allow folks to be able to log back into the main session. Do you want to wrap up? Darren, you want to wrap up for us with some closing thoughts?
Just thank you all for being with us. I do. Can you all hear me?
Yes.
Yep, super. No, thank you all. I think it's really important for anybody when you've been doing something for a while to take a step back and say, okay, what are we doing? Do we need to think differently about what we're doing? I think we've created and spent an amazing amount of time thinking about and figuring out how to do something that seems really basic, but is actually really complicated. How to connect people digitally using tools that my kids use, that schools use, that everybody's using, and we're not using them in healthcare. Now that we've done it, I think there's some really neat opportunities. I want to thank Rachna and Dina, because it requires other people, out-of-the-box thinkers, to who are willing to try things. I mean, this was just a crazy pilot that we just put together, on a shoestring, and it actually ended up providing some really important consults in Sacramento, in Texas, and other places, and we're excited about that. So I just want to say thank you to Dina, thank you to Rachna and Dr. Katz and your whole team for working with us, and thank you all of you who joined us. And hopefully we've stimulated some interesting new ideas. And if you have any that you'd like to try, just shoot me an email, and we'll be excited to talk it through.
Thank you for including us. Appreciate it.
Thank you.
All right, thank you all. Have a good day.
Good to
Thank
see
you,
you, Darren.
everyone.
Good to talk
Yep,
to
you
you
too.
guys.
And you
Take
should
care.
all
Bye.
have your link for the main session that was forwarded to you with a personal Zoom link. If you don't have that link, I'm going to stay on just for about another minute or so and help you navigate. So let me know if there's an issue. Thank you. And we're really excited. I think a lot of the themes that we've just learned will be pulled through for the rest of the day. So we'll see you there. Thank you.